Hey guys, welcome again. This is Navjeet. Today I am coming with info about diabetes. We all realize that sugar or diabetes is the most common disorder. About 80% people suffer from this. But nowadays, children also affected with this difficulty. This is the sign of our unhealthy lifestyle. Diabetes is a chronic metabolic disorder that causes high blood glucose levels in the body because of the defect in insulin production. Insulin released by the pancreas when we eat food and insulin allows the sugar to go from the blood into cells. When the cells of body not using insulin well, then sugar begins to build in our body. This is also resulting in hyperglycemia. Insulin regulates the uptake of glucose by most cells from the body. Deficiency of this hormone and insensitivity of its receptors play a major role in all forms of diabetes mellitus. According to the World Health Organization, diabetes is classified in three forms. First is type 1 diabetes. This diabetes is also known as childhood diabetes and insulin dependent diabetes. Most of people affected by type 1 exercise or diet can't prevent this. This diabetes can be caused by autoimmune destruction accompanied by antibodies which are directed opposite to insulin. The loss of insulin secretion, the function of the alpha cells is also abnormal. Without insulin, ketosis and diabetic ketoacidosis development will result in coma or death. Now there are some symptoms of type 1 diabetes. First is excessive thirst. Hyperopia means blurred vision. Other eye problems, fungal infections, foot ulcers, excessive urination, increase in heart rate and weight loss. So the next term is diagnosis. This type of diabetes can be diagnosed by random glucose test, fasting glucose test and primary plasma test. Fasting plasma glucose level at or above 126 mg per deciliter. The major goal of treating diabetes by controlling the blood glucose levels without causing abnormally low levels of blood sugar. Type 1 diabetes can be treated with exercise, insulin, and diabetic diet. So, the second is type 2 diabetes. This type of diabetes, also known as maturity onset diabetes, adult onset diabetes, and non insulin dependent onset diabetes. The main cause of this category is defective insulin secretion. The defective responsiveness to insulin, which involves the insulin receptor in the cell membrane. This diabetes may unnoticed for years since the symptoms are milder means lack of ketoacidotic episodes and some other complications which result in renal failure, vascular disease and vision damage. This type of diabetes can be diagnosed by random glucose test. Random plasma glucose levels at or above 200 mg per deciliter. Type 2 is first treated with weight reduction, diabetic diet, and exercise. When this order fails to control, then oral medications are used. If oral medications are still insufficient, then insulin medicines are considerable. There are some medications for type 2 diabetes. The first is medications that decrease the amount of glucose produced by the liver. Biguanide drugs are used for many years. The metformin is unique in its ability to decrease glucose production from the liver. Metformin does not increase insulin levels when used alone. It is used with oral agents and should not be used in patients with kidney impairment. Second is medications that increase the sensitivity of cells to insulin. These drugs are thiazolidinediones, lower blood glucose by improving target cell response to insulin. Sister compounds are now available with a better safety profile. These drugs include Pioglitazone and rosiglitazone. New medications that affect glycemic control. Symlin is a new class of injected antihyperglycemic medications for the patients suffer from type 1 and type 2 diabetes or treated with insulin. Symlin reduce post-meal blood sugar peak and reduce glucose fluctuation throughout the day and also lower the mealtime insulin requirement. So third is gestational diabetes. This type of diabetes develops during pregnancy and may improve or disappear after the delivery. Symptoms of this diabetes are polyuria, polydipsia, and polyphagia. It may damage the health of fetus. About 20 to 50% of women develops type 2 diabetes later in life. This diabetes occur about 2% to 5% of all pregnancies. It is temporary and fully curable. And if untreated, then may cause other problems like macrosomia. So okay guys, thank you so much for watching this video. Hope this info will be helpful for you. Don't forget to like, share and subscribe our channel.